What is up, YouTube? Today we are here to talk about referrals. A referral in the medical field is transferring a patient's treatment or care to another provider or doctor so that that doctor can better help the patient. For instance, you have a primary care doctor, and that primary doctor is not an STD specialist, or they're not a cardiovascular or heart specialist or a lung specialist. So they will refer you to a secondary provider. This referral has to be done in documentation form. It used to be for years that all of the referrals were paper referrals, and those paper referrals had to be in your hand if you wanted to go to that doctor to receive treatment. So if your primary doctor sent you to one physician, then that particular doctor would then have to have their information on who they are referring you to. So if we are looking at this referral form, this is what we would consider the old school referral form. As you can see, referring doctor. So your primary doctor's information will go here. Your doctor's name, address, and phone number, and the name of the doctor that they're referring you to. On there, you will have the patient information and any other information you need for the patient's demographics. Remember, the demographics are the first name, last name, phone number. Any insurance provider information can go here because the insurance provider will let you know how many visits you have on this referral. For instance, if you're being sent to a heart doctor and you have a certain insurance, they may only have the referral for 3 visits. Another insurance company's referral may be 6 visits. So this is why you need to put in the insurance company's name, because once you put the insurance company's name in where it says insurance provider, then you'll be able to look up how many visits for the actual referral you need. The referral information has to have the reason for the referral as well. See the reason for the referral. You can't say, well, because I felt like it. If the patient has diabetes, referring for diabetes management, referring for specialty care, patient was diagnosed with cancer, referring to the oncologist. So those are the main parts of the referral form. Who you are sending the patient to, who is it coming from, that primary doctor or the referring doctor. The referring doctor is always the doctor that is writing the referral. Referring to is going to be the person that the patient is being sent to. And again, insurance provider will determine how many visits. So really just working at an office, they will have a database of how many visits for each patient. And then last but not least, the reason for the referral. Because patients would lose these or we would have to print them, and we have a lot more medical care going on now electronically, referrals are now done in the system. So instead of you having to look for a paper referral and see how many visits you have left on it, you can actually go into the portal to see if a patient has any type of referrals in their electronic medical records. So if we want to go into our patient's records, we will then be able to see if a patient has a referral or not. So I'm going to pick one of these patients here and get the chart. Inside of the patient's chart, you should see an area for referrals. And as you can see, this person has a few referrals. They have at least 3 in here that I can see. There might be just 2. I really can't tell. I do see 4 names here. So I'm going to click in the referrals box, and then I'm going to click edit. So each of these doctors that are listed, as you can see, referred to and referred by is right here at the bottom. Okay, so you want to make sure whoever you're sending the patient to is selected. Referred by is who you're sending them to. So if I want to create a referral for a patient and I am sending my patient to the doctor, let's say I'm sending my patient to Dr. Able Body. And as it opens up, it will open up an area referred to, just as the paper form showed us earlier, and referred by. With every referral, you're going to need a reason for the referral. So I'm just going to type in back pain because we're sending our patient to a specialist. And then I'm going to save. It will ask you if you want to generate a report or not. Depending on where you work, you may or may not have to. Most jobs, when you write referrals, you're just writing the referral, you say no, and then your referral will be in the system. So if I go back, you'll have an extra referral in the system. Now, you might say, well, how do I know which referral is which? You'll know which referral is which based on who you referred the patient to and based on the referral orders. Each referral should have a different reason for the referral. So if you're seeing like 5 referrals for back pain, then we know that the patient somehow was either sent 5 referrals, and that shouldn't be that way. So we're going to look at this very first one, Dr. Harry Hart. And when I click on it, it says, oh, completion comments. So this looks like a referral from a patient who had chest pain. And then we have completion comments here, meaning that this referral has run out. And because it has run out, in the completion comments, either the patient is going to be finished with care or care has ended, or in this box, you're going to request one more referral. If I want to click on this doctor referral that I put in, as you can see, once we put the referrals in, it gives us a space to complete the referral. Referrals often have to be closed. Sometimes it'll look like the referral is still in the system, and most people say, oh yeah, you have a referral in here. But just because it is in the system does not mean it's an active referral. It could have run out, and you think that it's a referral that's good, but it's not. I'm going to go over that step again to look for a referral. So I'm going to create one right now and take a look at how different those windows are. So when I'm writing a referral for the first time or requesting a referral for the very first time, only the reason for the referral comes up. There is no completion of the referral box here. So, if you open up a referral and it looks like this means that you still have some visits left on the referral. There is no reason for completion because this referral is still active and it is not complete. However, if your referral is complete, when you click on the referral, it will give you a completion comment box and someone will have filled it in, or you'll be the person filling it in, stating that, okay, this is the end of this referral. Doctor requested a new referral, or the doctor requested the end of care, or there's no more referrals needed. Depending on where you work, they will tell you how to close out your referrals in the system. Okay, so I'm going to show that step one more time. I am referring a patient to Dr. Harry Hart. So I'm going to select Dr. Harry Hart's name, and I'm being referred by the current physician, which is Dr. Finchman. And the reason for this patient's referral, we're going to put down neck pain. After we select neck pain, we select done. And we see that we have the different referrals in here. When the referral is used up or the referral is ending with visits, the way we check is click on the actual visit. And if there is a completion comment box that appears, or some systems have it where they flash the number, like it flashes 0 left, or it says this only has one more referral. Would you like to order another one? So those are the things you may see to show that a referral is complete. Sometimes there are paper involved, sometimes the system is slow, and sometimes we just don't have enough people to work in the medical office to specifically handle these referrals. So, what do they do for people who are checking how many visits, closing referrals, creating new referrals? Those jobs are referral specialists. So, we're going to look at some jobs in as a referral specialist and see what those job responsibilities are. So we are going to go here and look to see if we are paid fairly, if we are offered a referral specialist position. So I'm going to put the referral specialist in, and it says a referral specialist in my area makes about 68,000. It looks like the base pay is 39, about 40,000 a year. And there's multiple companies that they had in the areas that talk about that particular job. If I scroll down further, it'll give comparable salaries to what people are making compared to how many years experience they have in similar areas. So if you wanted to search maybe like a different location, you can change the location there and see what jobs are out there. I can also search what jobs are available in that area. Now that I sort of kind of know what I'm looking for, I will type in referral. You have a referral coordinator. They may call it a referral coordinator, so keep that in mind as well. Or you may see patient authorizations and referrals representative. So let's see what this job is saying. A patient authorization referral representative, patient authorization in the hematology and oncology. So you're working with blood studies and cancer treatment referrals. $1,000 sign-on bonus for eligible hires. So 1 year of like coding, charting, or something like that. If you are a medical assistant or EHR technician, this might be a good job for you as a patient authorization or referral representative. So I'm trying to see where, okay, diversity, how what they're committed to. It's really talking about the team. I'm just looking for what you're going to be doing if they give you a description. So it might be all the way at the bottom here. Yeah, basically gives us the basics. It just says required referral coordinator prepares clinical data for physician for approval to obtain authorization and acts between patient and medical assistant, doctor, and care providers in the business office. So basically, you're just talking to them about how many visits they have left, letting them know that their referral is going to expire, entering those referrals into the system. And this particular one actually has a sign-on bonus. This is a recent one. As of 1 day ago, it looks like there. We have a referral coordinator for workers' compensation. So if your workers' compensation, maybe you need to refer these patients who've gotten hurt on the job to a new provider, and a referral based on the insurance company of the healthcare provider will give you that referral so that you can go to the specialist. So the function is to provide some compliance guidance to teams and workers' compensation. So coordinate referrals from the IPAC services on a national basis, provides parties with information and documentation needed to perform requested service. So as a referral coordinator, sometimes you don't have the right diagnosis, or sometimes you don't have the right doctor's information. Sometimes you have the wrong birth date for the patient. So as a referral coordinator, to push this information through, you would need to get that information. Maybe you're calling patients who were hurt on the job because this is workers' compensation, and you're getting information from them as to where they are going, where they can be referred to. You're going to be giving them documentation that your employer uses. We use these referral services, and we are referring you to one of our care providers. So let's look at another one. We have intake, biller, scheduling. Notice how a lot of these jobs are similar to some of the ones we saw before, because some of those jobs and referrals are actually taken over by the front desk staff. Maybe they don't have a busy office, but if you're doing this for a hospital service that has a doctor involved or a large medical practice, they may need to hire you in that area. So here's a referral coordinator for neurology, which is a nerve practice. Referral coordinator works under the supervision and is responsible for coordination of patient referrals to include submission, like I mentioned before, tracking, as I showed you how you can go in and tracking, patient scheduling, and closing out the loop of all referrals. So those are the basic things that our referral specialist is going to do. These items here with submitting, tracking, and scheduling, also when it expires, closing the loop, are things we're going to be doing. And as you can see here with this referral specialist, that is quite a nice salary. Why these documents are legal documents: critical thinking, knowledge of customer service. Doesn't say medical knowledge, it says customer service here. And it says customer service because you're dealing with clients. You do have to be nice to them and be kind. Sometimes when patients are a little nervous, they might be a bit testy. That does not mean you are going to take bad treatment, but just understand customer service practices can be used. So if you have a lot of customer service experience and you want to know about referrals or learn about them, the referral coordinator could be a great job for you. So I'm just going to go back one more time and show you that process of submitting the claim, tracking a claim in there, checking it out through proper channels of communication with a high level of professionalism. So let's take a look at our EHR one more time. So we are back in our medical records electronic system where we can actually look for referrals and we can actually submit them, write them, and track them. So we are going to add a referral to a patient's information so they can go to another provider and seek care. And as I look in here, I see that there are a couple of referrals in there. So I want to go and edit. Now in the chart, it looks like there's 3 of them, but here it looks like there's 2 of them. So it's probably because these 2 are active and one is expired and we need to close it out as the job description said, or we need to communicate to our customer, client, or patient that they maybe have one more visit and it's running out. So if we want to show all referrals that our patient has, typically there's a show all button. And as you can see here, when I click show all, one of them says no referral note added. Now remember, that's the first one. So this first one to Dr. Harry Hart, this is where no referral note was added. Harry Hart is the review for respiratory congestion, and able body, that's the third referral, a reason for their visit. So if you show all referrals, you'll probably see some that are expired in there or that have been closed out, or you see the 2 new ones that are ordered. So we're going to click on this first one where it says no referral note was added and it says delete it. Now I'm going to say yes for that one because we cannot write a referral without a reason. We mentioned earlier that all referrals must have a reason. So if there is an active referral open, but nothing is done with it and it was written like a month prior, chances are that it was either a mistake or there was no reason put in. So we don't know why the referral needs to be made, or maybe the doctor changed their mind. So, there are different things that we can know about that. So we're going to go in and we are going to add a referral to the system. We are going to go in and we're going to select doctor. We are referring our patient to doctor, who is an allergy and immunology specialist, because Dr. Finchman is the primary provider. Referred to and referred by. Notice here where it says appointment date. Also in the system, it stated that the patient may need to have an appointment scheduled for that particular visit. Sometimes when you write a referral, it's within the same system and the patient needs to just go across the street or down the hall. So a lot of times you are having access to schedule that patient for their appointments. So right in the referral screen, when you're ordering this referral for the patient, you can access ordering them an appointment for that doctor. So I'm going to give my patient an appointment on the 25th. And I'm going to make the appointment for 9 o'clock. So, and the reason for the referral, they have allergies or allergic reaction. Your doctor's a primary doctor. So we have to make sure we put that reason in. Once we save it, we can then look in our patient's chart and see that they do have the referral there. Once the referral runs out or the referral then is expired, we will be able to go into the system, check out that referral, and it will have a completion comment, a completion date, or something like that in there. Every system is a little bit different. When it's networked to like the cloud or something like that, it'll automatically take those numbers off. But based on where you work, you're going to have to learn their workflow process anyway. All referrals are referred to and referred by. All referrals have to have a reason for the referral. Most of your EHR systems will allow you to schedule to that new provider right in your portal when you're making a referral. Not all systems can do it. So it really does depend on what the hospital medical setup is and you working through all of that information. You may be responsible as the referral specialist to go in and close out all of these. You may need to go ask the doctor or look in the medical record to see if it's closed, or if the doctor wants a new referral assigned. So that would be your communication with the doctor. This patient's referral has run out. They're requesting a new one. Would you like to do a new referral or send a new referral to that patient? So you can go in and the doctor says, I would like to do another referral. So then you're going to have to say that you're going to do another referral in the system and then start a new referral process. Because once the visits on that referral expires, you cannot use that referral again. You would need to close that referral out. So all of this information that I've showed you about the patient and being able to order right from a particular window. Now we need to see if our appointment actually went into our system or not. So we're going to check that out. So to do that, to look up our patient to see if that appointment that we gave them through the referral window actually went through. Sometimes there's a glitch in the system. You don't quite see the appointment at the particular time. You might try to like go to a different schedule and you don't see like where the appointment went. So The best thing to do is, instead of trying to remember the date that the patient was scheduled to look for it, you're just going to find patient appointments or look up appointments by patient. So I'm going to look up my patient, and he should have that 9 o'clock appointment scheduled that I put in to refer him for Well Child for his allergy visit to the professional. So I look up the patient's name. And as you can see, he's got all of these appointments that he's ever had in the past. If I scroll all the way down at the bottom, sure enough, there it is. That 9 o'clock visit that we put in is in there. So make sure that we take a look. We can even see it's on this schedule here. If we want to change a doctor, we can also change a doctor and see if a doctor changes. Sometimes information is put under the wrong provider. So you may be looking at a screen and say, I know I put in a 9 o'clock appointment, but I do not see my 9 o'clock appointment after my referral. Simply just change the schedule to the proper doctor, and you will see your patient's information pop back in there. Okay, so this is typically what a referral specialist does. It is a highly legal process. It is a professional process where you can talk to the doctor, clients, and patients. You may have a referral lost in the system somewhere, or maybe the patient is not sure how many visits they have left. So your job simply would be to go into the patient's record and to kind of see what's going on. Maybe it's a referral that wasn't closed out properly. Maybe it's a referral where you're waiting for information from the doctor to complete it. Maybe it's a referral from the insurance companies and they need more information. If you want to see all referrals that a patient has, you're going to select show all, and you can see any of those referrals that were put in before. Each referral is going to have its own special reason. You will not be able to get care from a specialist without a referral. And I have in the past gone to doctors where I've had a referral, didn't know I needed a referral. So the referral specialist may be saying, yes, I know you don't need a referral, maybe to the ophthalmologist or maybe to the back doctor or to your physical therapist, but your insurance company says you need a referral for the heart doctor. So sometimes that referral specialist will have to communicate that information about referrals. Updates to insurance companies happen all the time. Updates to how many visits per type of procedure changes all the time. So you can see why they would need a referral specialist. If that referral is not filled in and the patient then happens to go to the doctor, he may be responsible for that medical care because he did not get the referral. And we're seeing a lot of patients that are like, I know this is covered. I was told I had referrals in the system. And a lot of times it's not the patient. It's either that it wasn't done properly. We didn't have enough people in the system. Imagine how many referrals were needed during the time of the beginning of the pandemic. And the reason why we needed so many referrals, we had people who maybe had COVID that turned into some other condition. Maybe they turned into a respiratory condition and they needed to see a specialist. Maybe they developed some sort of allergy, or maybe their primary doctor just really wanted to send them to a specialist just to make sure they are okay after contracting the virus. So imagine the amount of referrals that are out there now versus how many referrals were out there before. We don't want patients to have to pay for care that would be covered. And we want to make sure that patients could see these doctors and specialists that they need to see as fast as possible. So doing these referrals in the system is definitely a quicker and faster way to help the patient track them, submitting one, making an appointment through a referral, or completing a referral through the system. So, just one more section here. We're going to look at this referral clerk. This one is a remote position. This one is within a particular state. Some jobs will be remote and say in state only, others will say remote anywhere. So, just make sure you actually read the description of each of these positions. So, if I am going into the referral clerk position, it says will participate in maintaining the culture of the office. Okay, prepare the referral information received from the physician. So the doctor is going to send you that information in either electronically or paper. Review the referral and authorization information. You're going to verify if it's accurate and record the information into the system. Respond to any inquiries that the provider and patient may have about the referrals. A patient may ask you, how many visits do I have? A doctor may ask you, how many visits do they have? Or a doctor may be saying, do I need a new referral for the patient if they need 3 more visits? So you go back and look and you find they only have 1 visit. So your answer would be yes. After searching, yes, you would need to do a new referral because there's only 1 visit left on this referral. You're going to make sure you have any reports or requests that are in the portal. And it's 1 year experience with medical office or front desk, and it says 1 or more years in this environment, or minimum 2 years dealing with any sort of managed care or maybe an office that deals with customers or clients. So that is typically what your referral specialist will do. I want to make sure that all of you are paid what you are worth. If you're thinking about a career move and you really want to know how certain jobs are rated or insights into a certain company, you can search a company by their name. You can go into the Know Your Worth section and enter a job title, which can then calculate your salary. So if I type in a job here for a medical referral, and they have a few different ones in here: medical referral specialist, medical referral coordinator. They're all pretty much the same. A coordinator might have a little bit more of a responsibility. I would just really go in and just search the different titles. I would go in and calculate salary. And to the right, it'll ask what kind of education, average salary. So this is education, bachelor's degree, total pay, average 2 to 4 years experience is going to get you what you see here on the screen. Now, keep in mind, you may be a service coordinator. You may have more experience doing even more. And as you can see, with more experience, the salary does increase, which is a good thing. There's also medical referral coordinator jobs that you see that are associated with medical referral. So maybe you want to do something similar to medical referrals where the skills cross over and they can either train you or you have a general understanding. Then you can maybe be a patient coordinator, coordinating the patient's schedules for them. So please make sure, if you are using Glassdoor, that you make sure you use all of those keys here. Talk about a good career move, whether you're looking to hunt a job. Even employers use this for a talent pool to kind of manage to see how well they're paying in a particular field. You can type any title in, from customer service to transport to driver. All of these jobs will come up, and then you can go in and search and find jobs with those titles. So make sure that you know your worth and you can do the proper job search so you really know what you're getting into as a referral specialist in your area. My name is Carla. I am here to tell you that there are so many jobs here, so many shortcuts, which is why I've updated my channel name to Carla Career Shortcuts and Coaching. Hopefully, you will like and subscribe. Please put a comment down in the comments about these types of jobs. And if you want to learn how to do these referrals, please check out the description and the comments for the free medical software that I am using so you could practice these skills, get some hands-on knowledge of it, and really go in and get some of these jobs. Everybody have a wonderful day. Thanks for watching and take care.